Well, Penhanda, and thank you once again for joining me today. This week we have held the latest 3-week review of the coronavirus regulations to see if we are able in Wales to move fully into alert level 0. I'll begin as usual by sharing the latest information we have about the state of the pandemic in Wales, and this is the information that the Cabinet has had in coming to the decisions that I'm setting out today. Now, when I was last here 3 weeks ago, coronavirus cases were rising sharply throughout Wales. Today, I'm pleased to say that cases are once again falling in most parts of the country. On the slide that you will see in a moment, you will be able to see the way in which the most recent surge in cases took place from the beginning of June and into July, never getting back anything like to the figures we saw back at the start of the year, but nevertheless a sharp increase. The good news is at the end of the slide you see in the last 10 days or so the start of cases beginning to fall back again. Today there are around 130 cases per 100,000 people in Wales, and that figure is lower than it was 3 weeks ago, and that has helped us in creating the conditions in which we are able to move forward. Now, the other crucial factor in shaping our decisions, of course, is vaccination, and as of today 82% of adults in Wales have had both doses of the vaccine. With every day that passes, that number continues to increase as more people make the decision to protect themselves and their loved ones. Our high vaccination rates, some of the best in the whole of the world, have helped to weaken the link between coronavirus infections, serious illness and hospitalisation. But as cases in the community rose, we have seen a small but noticeable rise in the number of people who have fallen so seriously ill that they have needed to be admitted to hospital. And very sadly too, there has been a small rise in the number of people dying from coronavirus, each one leaving a family mourning the loss of a loved one. And once again, as ever, our thoughts are with all those families over the whole of the last 18 months whose lives have been changed as a result of this awful virus. And while the numbers are much smaller than they have been in previous waves, thanks to the success of vaccination and the way in which everyone in Wales has stuck to the rules, those figures are a sobering reminder of just how awful the virus remains. Now, we have carefully looked at all the evidence and the data, and as a result I can confirm that we will be moving to alert level 0 here in Wales as from 6 a.m. tomorrow. Now, having reached this important milestone, we now need carefully to monitor the impact of lifting so many restrictions, and we therefore do not expect to make any further changes at the next review. So the changes we've announced today set the pattern for at least the next 6 weeks. And that's why this is such a significant moment for us all. For the first time since the pandemic began, all business will be able to open and all legal limits on meeting people in indoor private spaces will be removed as well. But alert level 0 does not mean the end of coronavirus, and it very certainly does not mean a free-for-all here in Wales. We still have people who are clinically vulnerable in our communities, and most people in Wales want to go on acting carefully to protect their health and the health of others. Because while we go on doing so, we can all enjoy personal freedoms with a confidence that there are still important protections in place to make sure our public health is being safeguarded. So even at alert level 0, we will continue to ensure that employers take steps to protect their workers and their customers. COVID risk assessments will be a legal requirement for all businesses, employers and event organisers. Now, they will have greater flexibility about the reasonable measures that they must put in place based on that risk assessment to reduce exposure to the virus. But the measures that are identified must be implemented. And here in Wales, the advice of the Welsh Government continues to be that people should work from home wherever that is possible. Face coverings will continue to be a legal requirement in indoor places, except for education and hospitality settings, and of course on public transport and when visiting hospitals or care homes. As from this weekend, there will be no legal limit on the number of people who can meet in private homes, but also in public spaces or at events. And as I've said, all businesses will now be reopened. Now, as we move into alert level 0, it becomes more important than ever that as many people as possible are vaccinated, because it's vaccination that has got us to this better place. Thanks to the incredible work of our vaccination teams and the enthusiasm of everyone in Wales, we have very high take-up rates against most priority groups and age groups. In many cases, in most cases in fact, more than 90%. We continue to make good progress in the younger age groups too, but I want to encourage everyone, especially in those younger age groups who've yet to come forward and have a vaccine, to come and get one. It's never too late to be vaccinated here in Wales. It helps protect you, your friends and your family. And making an appointment is really easy, and in many parts of Wales you can simply turn up to a walk-in clinic. Now, health boards have started to invite teenagers approaching their 18th birthday for their first vaccination, and children who live with clinically vulnerable adults. And as of today, they have also started to send invitations to 16 and 17-year-olds, having received the JCVI advice just a couple of days ago. And of course, we want as many of these young people as possible to be vaccinated before the new school and college terms begin. So from tomorrow, all adults who have been fully vaccinated and under 18 will have an additional benefit here in Wales, because they will no longer need to self-isolate if they are identified as a close contact of someone who has tested positive for COVID. Of course, anyone, whether they're vaccinated or not, must self-isolate if they've got the symptoms of the virus or if they have been tested as positive. This is what helps us to break chains of transmission while keeping Wales safe and keeping Wales working. And we're going to do more to support those on low incomes who still have to self-isolate, raising the £500 self-isolation payment to £750 and making it easier for people to apply. And the payment will be available to all those who are eligible who are told to self-isolate. Now, there's a lot to take in from what's been announced today, and we're going to put a slide up which will show a summary of the main changes as we move to alert level 0. All the changes that you see summarised on the slide, the lifting of the numbers of people who can meet together, flexibility for businesses reopened and so on, all of those are the changes that will come into effect from tomorrow. And we've only been able to do this because of everything that everyone in Wales has done, because of the way people have followed the rules and worked so hard to protect our families and to keep Wales safe. Moving to alert level 0 is another big step closer to life, as it was before the pandemic began. But we must go on working together to keep this virus under control. Everything we do has an impact on the virus. Together, we can keep it under control. Together, we will keep Wales safe. Diolch o galon I chi gyd am popeth chi'n ei wneud. Now, as usual, to take questions from journalists, and as ever, all the answers will be broadcast on the Welsh Government social media outlets. And I'm going first this afternoon to Felicity Evans at BBC Wales.
First Minister, thank you very much indeed. I'd be grateful if you could answer in Welsh as well as English. Are you confident that we're now in the end game in terms of the battle against coronavirus, or do you fear or expect further difficulties in the autumn and winter?
Well, Felicity, thank you. Provided we do not see further unexpected turns in the course of the virus, then I think we can have confidence that we are on the final lap of emerging from the pandemic. But we cannot possibly make the assumption that the virus might not yet have further unpleasant surprises for us. That's been the history of the 18 months, and were a new variant to emerge, or the virus take a turn in which vaccination were less effective than we have it today, then inevitably we would have to face the consequences of that and take measures to address it. While things remain as they are, while we all go on making the contribution we can, I think we can have some confidence that today's latest steps out of coronavirus put us on that path beyond it and into the future. Wel, os ni gyd yn just yn bwrw mlaen I wneud popeth ni wedi wneud dros y pandemig I gyd, ac os mae sefyllfa yn aros yn ei le, ble mae pethau heddi, allwn ni gyd cael rhyw fath o hyder, ni'n ar y ffordd mas o coronavirus. Ond y hanes o'r, a flwyddyn a hanner diwetha yw, mae'r virus, mae'n dal yn gallu troi a dod rhywbeth newydd ac yn anodd ar y bwrdd, am reolyn newydd. Rhywbeth sy'n creu y brechlyn yn llai effeithiol nag yw y brechlyn ar hyn o bryd. So, os allwn ni symud ymlaen fel ma ni heddi, allwn ni weld llwybr i'r dyfodol a tu hwnt i'r coronavirus I gyd. Ond I wneud hynny, rhaid I ni gyd fod yn ofalus ac yn ddigon hyblyg I ymdopi os mae'r cyd-destun yn newid.
Thank you. And just to pick up on the comments that you were making about vaccination rates amongst younger people, the latest figures for Public Health Wales show that amongst 18 to 29-year-olds, only 54% are double jabbed. Now, you've said you don't want to incentivise and you don't want to encourage passporting for things like nightclubs and that sort of thing. So I just wonder, is there a plan to try to push that take-up higher?
Yes, it's important to just explain that. The reason why the second dose of vaccine is still in the 50s is because not a sufficient number of weeks have elapsed for quite a lot of young people to come forward for the second dose of vaccine. It isn't that we are seeing a hesitancy at the second dose. It's just that 8 weeks need to go by before you're invited, and many young people, that period of time is yet to be completed. So we're over 75% of first doses, and that number goes up every day. We wish it could go up faster. Of course we do, and that's why we are doing all the things we are doing to make vaccination more readily available to young people in the way they lead their lives. These are very often people who are in work, where finding time to come forward for appointments is more difficult. It's why we've got the pop-up clinics and the walk-in clinics and the different ways in which we are trying to make it as easy as possible for people to come forward for vaccination. And the appeal we make to people in Wales of all ages, including our young people, is not one in which we are trying to alarm people into vaccination or to appeal to people on the basis of just their own benefit. What we say to our young people and everybody else is, if you come forward for vaccination, you are playing your part. You are making your contribution to your own safety, of course, but to the safety of your friends, your families, and to that great collective effort that we've made here in Wales. Do you want me to do a bit of that in Welsh as well?
If you would, please, thank you.
So ar hyn o bryd, reswm pam mae just fwy na 50% o bobl ifanc wedi cael ar ail dos o'r brechlyn yw mae'r wythnosau sy'n cwmpo rhwng yr un gyntaf ac ar ail ddim wedi cael ei wneud gyda nifer eitha fawr o bobl ifanc. Maen wedi cael yr un gyntaf ac nawr mae rhaid iddyn nhw aros am yr ail. Mae fwy na 75% o bobl ifanc wedi dod ymlaen i cael y brechlyn yn barod ac wrth cwrs ni'n eisiau fwy o bobl ifanc i wneud hynny. Dyna pam ni'n gweithio mor galed i wneud yn gyfleus i bobl ifanc i dod ymlaen am y brechlyn. Maen nhw'n gallu just yn cerdded i fewn i'r clinic sy'n cael y brechlyn mwy na lai mewn bob cwr o Gymru nawr. Ac yr apel ni'n neud at bobl ifanc yw nid just i trial i roi ofn arnyn nhw i wneud a wneud just i ddweud mae hwnna'n rhywbeth pwysig i chi. Beth ni'n esbonio i bobl ifanc fel pobl i gyd yng Nghymru. Y pwrpas tu ôl i dod ymlaen i cael y frechlyn yw i helpu eich hunan, ond helpu pob un o ni yma yng Nghymru. Pobl sy'n agos ato chi, ond Cymru i gyd. A mae hwnna wedi gweithio ac dyna'r y ffordd ni'n mynd i bwrw ymlaen i treuli perswadio fwy o bobl ifanc i dod ymlaen ac i helpu ni gyd yn y ffordd na. Felicity, thank you very much. Over to Adrian Masters at ITV Wales.
Thank you, First Minister. I wonder if I could get some clarity. Can people in a pub or restaurant from tomorrow night, can they stand at the bar? Could they drink standing up? Can those pubs be full? It's not a frivolous question. It's more because for a lot of these businesses, it is part of their business model to be full. Yeah. So I wonder if you could spell out and give some clarity on that.
Sure. So what those settings will have to do in future in Wales is to follow this set of steps. First of all, they will have to carry out a risk assessment of their own premises. Secondly, they will have to involve in the carrying out of that risk assessment the people who work in that premises. Thirdly, they will have to make that risk assessment available to anybody who wants to see it. And fourthly, they will have to identify and then put in place the reasonable measures that they can take to go on safeguarding their staff and their customers from coronavirus. Now, up until now, there have been a series of things which they've had to do. Now those things become part of the repertoire that they can draw on in the reasonable measures way. That can include social distancing. It can include limits on the number of people at any one venue. It certainly should include consideration of things like ventilation. There's a list of things which people will have to think about and apply in their own individual circumstances. And when they are satisfied that they have taken those reasonable measures to keep their staff and their customers safe, then they'll be able to open on the basis of the assessment that they themselves have made.
Would it be fair then to say that you wouldn't really expect to see full pubs?
I'm not going to say that, Adrian, because, if pubs are well ventilated, if they run on the basis that, you don't have to have very large crowds of people up at the bar itself, there are measures, reasonable measures, which the sector itself has been, I think, very creative and positive in helping to develop, and provided they are confident that in that setting those reasonable measures are in place, then I think people will make those judgments, because they will want, this is the thing I think we've learned from businesses, is they understand that they have to give people confidence that if they come to that venue, their health and their welfare has been thought about in advance, and then they'll be keen to come through the door.
Thank you. And can I also then ask you to spell out the situation with regards to the law on social distancing in workplaces? I understand that the 2 metre rule, the 2 metre law as it stands, is that going tomorrow? Is that being scrapped from tomorrow? If it is, why haven't you stated that more explicitly? If it's not, isn't that likely to lead to more difficulty and confusion?
So social distancing is not disappearing in Wales. But what the way the law formulates it is changing in this way. Up until now, the requirement to maintain social distancing has been a standalone regulation here in Wales. In future, it becomes one of the reasonable measures that a workplace will be able to consider when it is making sure that it has put into action those things that keep workers and visitors to those workplaces safe. And there will be many, many places that will continue to use social distancing as one of those protective measures. But instead of it being a standalone requirement, it becomes part of the longer repertoire, the longer list of things, with more flexibility, therefore, for businesses to decide the combination of actions that they can take to make sure that the reasonable measures are in place. That's the way the law has changed, not by eliminating social distancing at all, but by making it part of that wider list of things with more flexibility for businesses to draw the right set of measures together.
Thank you.
Adrian, thank you. To Rebecca Miles at LBC.
Diolch, Prif Weinidog. You've not ruled out the fact that some restrictions may need to be brought back in. Can you give us some clarity and explain to us now what that trigger point would look like to bring the restrictions back in so that people can work to avoid that happening?
Well, Lily, thank you. And you're absolutely, Rebecca, rather, you're absolutely right to say that. There are things we can all do and need to go on doing to avoid us being back in that position. Now, as I said in my earlier answer, I don't anticipate that we will be back in that position. Certainly not back to the level of restrictions that we had to go through together at the start of this year, because vaccination has altered the relationship between falling ill and hospitalisation. What we will do, though, is to keep our eye, as ever, not on one single indicator, but on a range of indicators. The biggest danger remains that the virus throws another unexpected difficulty in our path, that some new variant emerges, and a variant that isn't as effectively dealt with by vaccination as the current one. So we'll certainly be watching for that. We're watching very carefully at the extent to which the protection that vaccination offers you lasts. So that's why we will have a booster campaign here in Wales in the autumn to offer a booster vaccination, particularly to the most vulnerable people in our society. And the more people who take up the booster vaccination, the stronger our defences will be. We will be looking at the normal things like positivity rates and the number per 100,000 of people who fall ill, and, of course, on the impact on the health service. And if we ever needed to go back to some further control measures, it would be because we've made a judgment in the round that those actions are needed to protect people in Wales from the latest twist and turn in coronavirus. But hopefully, and we've got reasons to be optimistic, we won't face that. And provided we go on maximising the contribution the vaccination offers, doing all those small and simple things that we can do together, the gains that we have made together for more than 6 months now. We started on this journey back in February. Gradually, step by step, lifting restrictions. We'll be able to sustain that into the autumn and beyond.
You said this morning that you could look at needing vaccine passports for voluntary venues such as nightclubs. And I wonder if this morning you can give a clear indication on whether that will happen and how that will happen so that the sector can prepare should they need to.
So I was making a distinction in the question I was asked between places that we all have to visit, and there will be no plans in Wales to have vaccination certificates for those places we have to visit because we don't have any choice about it. I was making a distinction between that and places which we attend entirely voluntarily, and just saying that there's a different set of considerations that you have to weigh up there. But there are ethical considerations, there are equity considerations. You need to think about people who can't be vaccinated, not simply people who don't choose to be vaccinated. You have to think about whether the very considerable apparatus that would have to be in place there to make sure that those vaccine certificates could be produced, that they couldn't be fraudulently produced, that they could be properly policed in those venues. You'd have to weigh all those things up before deciding whether or not this was a measure that had more advantages to it than disadvantages. We're definitely not at that point here in Wales, and we won't be, I think, for a number of weeks yet. But we will weigh it up. We will do it in the way we normally do. We'll take the best evidence we can. If we thought that it was a practical and proportionate way of protecting people in Wales from coronavirus, then the case would probably be made for it. But it's quite a high threshold that you'd have to get to, even in those voluntary settings. Rebecca, thank you very much indeed. Over to Will Hayward at Wales Online.
Thank you, First Minister. This morning, Leonard Morgan said that we were likely to have a September peak of the virus in Wales. Can you explain what the modelling says this will be like in terms of hospitalisations, deaths and cases? And in the same interview, she said that flu would be, to use her words, back with a vengeance this winter. What does that look like in terms of cases and deaths? And would you ever consider locking down because of high flu cases if the NHS looked like been overwhelmed this winter?
Well, thank you very much. So the peak in September is the result of schools returning and colleges returning. The model says that when people are back mixing in the way that they inevitably do in education settings, we must expect to see the numbers move upwards. But the model does not predict that the numbers will move up sharply or that they will drive numbers into the hospital system on the scale that we saw in earlier peaks of the virus, particularly because we know that even when young people do fall ill, they're less likely to fall seriously ill than any other parts of the population. So while the model does predict, as Elin had said, that there would be a further rise and a potential peak in September, the model at the moment is not suggesting that that would lead to such significant impacts on the NHS that we would have to think about that. Elin is quite right to draw attention to the risks that this winter we will see a level of influenza and respiratory infections more generally of a very different order to the one we saw last winter. So last winter we had the lowest flu season almost since records of the sort we have now began, certainly in the whole period of devolution, partly because we were all self-isolating and keeping a social distance and all of those things. And as we do less of that, there must be a realistic risk that we will see influenza come back in a way that we didn't see last year. And that does, not everybody who gets the flu just is able to manage it at home. For some people, and particularly vulnerable people, it does mean hospitalisation. It's going to be a challenging winter for the NHS. And that means that all the things we've been talking about today, all the things about continuing to respect other people, wearing masks in crowded places and so on, all of those will make a contribution on that wider waterfront, as well as specifically in relation to coronavirus.
Thank you. You've said there will be no inquiry into COVID specifically here in Wales, and I appreciate your argument that the actions of the UK government have made a direct impact on the virus here in Wales, so these things should be looked at together. But the second wave of the virus last year was by far the most deadly, and the decisions around that were overwhelmingly handled by the Welsh Government. Do the families of those who died deserve to understand what happened specifically here in Wales? And should we not be learning lessons here in Wales about decisions that were made here in Wales, rather than being a footnote in a UK government or a UK-wide inquiry?
Well, there's no suggestion whatsoever that we will be a footnote in a UK-wide inquiry. Part of my agreement to being part of a UK inquiry is that there will be within the UK inquiry a specific focus on the actions that were taken here in Wales. And I expect that to be a thorough investigation, and I expect it to offer the answers that families in Wales are entitled to have about the way the decisions were made on their behalf during the pandemic. So I still believe that the best way of people getting those answers, and answers that will make the best sense for people, is to have an inquiry that is able to look both at the things that went on specifically in Wales, Scotland, Northern Ireland and England, where decisions were only being made on those jurisdictions, but can also look at the interplay between decisions that were made in one part of the United Kingdom and decisions that were being made for the United Kingdom as a whole. You really will not get a proper understanding unless you have both sides of that coin being looked at, and being looked at by the same group of people with the same sets of powers, able to look at the experience in the round. And I definitely expect that within that, the Welsh experience and experiences elsewhere will not be a footnote in any way. They will get the thorough and proper attention that they need and they deserve.
Thank you.
Well, thank you. Drawi Thomas Evans, S4C.
Diolch yn fawr iawn i chi, Brif Unidog, pnawn da. Chi eisoes wedi sôn y bydd busnesau lletygarwch ac adloniant yn gorfod cynnal asesiad risg a chymryd pob cam rhesymol i leihau'r risg o ledaenu coronavirus. A fydd yna gefnogaeth ariannol ar gael i'r busnesau'r rhain i gadw'r mesurau yma gan gynnwys cyfyngu ar y nifer o gysmeriad fel bod nhw'n gallu parhau ar rheini?
Wel, Thomas, diolch yn fawr. Beth chi wedi dweud yn wir, mae bydd yn angenreidiol i'r lletygarwch a pob le eraill i wneud asesiad o risg ac i defnyddio'r camau resymol maen nhw'n gallu roi yna i le i warchod bobl sy'n gweithio ac sy'n defnyddio cyfleusterau. Dwi ddim yn meddwl bydd lot o achos i roi fwy o arian i wneud pethau fel yna, achos maen nhw wedi wneud nhw yn barod. Dyn ni ddim yn siarad am pethau resymol newydd, ni'n siarad am y restr o'r bethau. Mae lletygarwch ac pobl eraill wedi creu yn ystod y flwyddyn a hanner diwetha, ac bydden nhw nawr yn gallu defnyddio y restr yn fwy hyblyg. Dyna'r cam bwysig ymlaen iddyn nhw. Mae nhw nawr yn gallu asesu y risg yn lleol yn y lle ble mae nhw'n gyfrifol, ac yn rhoi pethau yna le mewn ffordd fwy hyblyg. Thomas was asking me whether the need for risk assessments and reasonable measures in hospitality and other settings would mean that there would be further financial help to businesses to put those things in their place. And I was confirming he was right that those risk assessments and reasonable measures must be taken. But it's not that we are asking for a new set of measures. These are the measures that those settings have already been deploying. The major difference is that from now on they will be able to do so with more flexibility. The things that they have been deploying already, they will be able to use as a menu of possibilities that they can draw on, making their own assessments in their own settings, and then putting together those reasonable measures from the repertoire they have already developed. And in that sense, I'm not yet seeing what the case would be for significant further financial help to do things that they have already been doing and can now just deploy in a different way.
Diolch i chi am hynny. Ac os oes yna rhywun yng Nghymru am fynd ar eu gwyliau dramor ar hyn o bryd, mae rhaid iddyn nhw i dalu 88 pint y pen am brawf. Yn Lloegr mae profion ar gael am llai nag 20 pint yr un. Ydych chi'n bryderus mai dim ond pobl sydd â digon o arian fydd yn cael mynd ar wyliau tramor dros y misoedd nesaf, ac ydych chi'n meddwl bod hynny'n deg?
Wel, jyst i ddweud unwaith eto, prynhawn yma, cyngor Llywodraeth Cymreig yw, hwn yw y flwyddyn i aros gytra. Hwn yw y flwyddyn i defnyddio popeth sydd 'da ni yma yng Nghymru ac i fwynhau aros adre am y wyliau. Pan mae pobl yn teithio tramor, mae yn pwysig i ni, nid jyst iddyn nhw, i ni gyd yn bod yn hyderus. Mae'r profion maen nhw'n defnyddio yw profion ni'n gallu dibynnu arnyn nhw. Ac profion ble mae'r canlyniadau yn mynd syth i fewn i'r popeth mae'r meddygon teulu a bobl eraill yn gallu defnyddio os bydd pobl yn dod yn ôl ac yn cwmpo'n dost. Dyna pam ni'n ofyn i bobl yma yng Nghymru defnyddio y profion sydd ar gael trwy'r gwasanaethau iechyd, achos ni'n gwybod mae safonau y profion yna ac y canlyniadau hefyd yn gallu gweithio i'r bobl eu hunain, ond ni gyd dy gilydd hefyd, ac hyn o bryd dyna'r sefyllfa ni'n eisiau weld i parhau yma yng Nghymru. Thomas was asking me about people who choose to travel abroad for their holidays, and the fact that in Wales we require them to have an NHS test, which costs more than tests that you can buy in the private market elsewhere. I was reconfirming the advice of the Welsh Government that this is the year to holiday at home, to use everything that Wales has to offer, and therefore to mitigate the risks that inevitably come from travelling further afield. And the reasons that we ask people to use the NHS testing system is because we can all be confident, not simply the people themselves, but everybody else too can be confident that those tests are of a proper standard, and very importantly, that the results of those tests can be transmitted immediately to the patient's own record. So if someone does return from overseas and falls ill with coronavirus, then they will be able to get the treatment that they need because the tests will have been reported into their patient record. And sorry, I didn't mention this in my Welsh answer, but it's an important part of it. It also means that we are able to carry out the genetic sequencing of those tests, which is one of our major defences against the entrance into Wales of new variants of the disease. And we have one of the most advanced ability to do that genetic testing of any country in the world here in Wales. We can do it when there are NHS tests. We lose that ability when tests are carried out elsewhere, and that's why we have the system that we have here in Wales. Thomas, diolch yn fawr. Over to Lily Hewitson at GB News.
Thank you, First Minister. You've used the word cautious to describe the Welsh Government's approach to coming out of lockdown at every single stage. Have you felt any pressure from the other UK nations to make the move to alert level 0? And do you feel this decision is still a cautious one and in line with your decision making over the last year or so?
I've not felt any pressure from any other UK nation, I'm pleased to say. We've had, as I've sometimes explained, a better system since Christmas, where we've been meeting weekly with the UK government and Scotland and Northern Ireland, and we use those sessions to share information and to look to see where we can help one another with the things that we've tried in different places, but it's never been a forum in which we try and persuade each other to do what is right for the different parts of the United Kingdom, so I can be sure about that. Yes, I think this is, the latest step in the approach we've taken in Wales throughout the pandemic, step by step, always able to review the impact of what we have done so that if we are able to move further ahead, we do so confidently, knowing that we are not adding to the risks that people face in Wales in a way that we don't think is controllable. It's partly why we won't introduce further changes in 3 weeks' time. As I said in an earlier answer, we don't expect to change this regime at least for 6 weeks, and that's in order to enable us to have a good set of information monitoring of the impact of these decisions to make sure that as we move beyond them, we're still keeping people in Wales as safe as we can.
Thank you. And a question on something that's not coronavirus related, if that's okay. I've recently heard that you've written to members of Vale Communities Unite, who are a team that are working to appeal the recent planning permission on Model Farm, which is in the Vale of Glamorgan. As you'll be aware, the building on this farm will see 100 acres of prime biodiverse farmland and ancient woodland destroyed and a fourth generation farmer moved on. You said in that letter that you'll be working with the Climate Minister to review the papers around the building on Model Farm. Can you provide any kind of comment or update with your thoughts on how the current plans to build on the farm don't consider Project Zero, that climate emergency policy, and where you perhaps see this going next?
Lily, I'm afraid I probably couldn't or shouldn't say more than I've said in the letter already, because in these decisions, the Welsh Government ministers act, in a what's called a quasi-judicial way, and our decisions are therefore always challengeable through the courts. So anything I might say would become, actionable in that way, and that wouldn't be sensible of me. I welcome the letters that I get from many parts of Wales where people feel that decisions that are being made need to be further considered or thought of in ways which takes the full range of information into account. And when I replied to the letter in the Vale of Glamorgan, I was just giving people an assurance that we would go about it in that sort of way when Welsh Government ministers have responsibilities to discharge. Thank you very much. Over to Ariane Brumwell at the Brecon and Radnor Express.
Hi, thank you. So just to clarify quickly, you mentioned about how businesses are doing their own risk assessments, introducing their own measures. Does that mean, in theory, even though it's not a Welsh Government requiree to wear a face mask in a restaurant or a bar, does that mean in theory that individual businesses could maintain those measures? And does it also mean that track and trace will still be in place within certain venues?
Well, thank you. There's both very good questions. The answer to the first question is yes. Face coverings are potentially part of a suite of reasonable measures that an employer could take or a restaurant could take, and they could decide, although it's no longer obligatory in the way that it was in hospitality settings, they would want to maintain it as part of the suite of measures that they were putting in place. So yes, that's part of that new flexibility. There'll no longer be, as you said, a legal obligation on hospitality owners to collect the contact details of people. That would not prevent a restaurant or a pub deciding to collect contact details if they felt that the circumstances merited that. And the track and trace system will still be here. Maybe I could take 1 minute to extend the question a little, because I haven't had a chance to explain that while self-isolation for people who've been doubly vaccinated will no longer be required in Wales, people will still be contacted by the Test, Track, Protect system to give them advice, to advise them that they should take a test, a PCR test at day 2 and day 8, to advise them not to go and contact vulnerable relatives, for example, during the period that they've been in the days after they've been in contact with somebody who has fallen ill with the virus. So the TTP system will still be here, will still be contacting people, but with a slightly different purpose, a sort of what they call a warn and inform message, rather than an instruction to self-isolate.
Great. And then with track and trace then, going off that, how crucial would you say they've been during the pandemic to get into this point of going to tier 0?
Oh, look, we've had a very successful TTP system here in Wales. As people will know, we've organised it very differently. It's been a public service here in Wales. The people who contact you are not people working for some private company on a call centre basis. They're people who work for the local council or the local health board in your area, and their motivation is entirely to make sure that you are well informed and properly protected from the virus. And it has sustained levels of performance. You know, the percentage of people who they've managed to contact within 24 or 48 hours has been remarkable, really, throughout the whole of the pandemic. That is why we will continue to run a TTP system, even in the new circumstances, because coronavirus hasn't gone away. You know, hundreds of people fell ill with it for the first time again yesterday, and no doubt there will be hundreds of people still today. So even when things are improving, there's a real job of work for TTP to do, and we're in the fortunate position that they will be doing that, building from the success of the system here in Wales to date. Ariane, thank you very much. Over to Nathan Shoesmith at the Speaker.
Thank you, First Minister. Good afternoon. Your government's expressed concerns on a number of occasions about international travel and how the tier traffic light restrictions, are being organised for that. Quite how concerned are you about it? Are you concerned that it could lead to further outbreaks in Wales later this summer? And is this the only issue where communication with the UK government has broken down, or is this a symptom of other issues as well?
Well, it's not that communication has broken down, Nathan, it's just that we take a different view. So we continue to have plenty of opportunities to put that view to the UK government. It's just that their view of the risks is different to ours. Our view is coloured by our experience of last autumn, when our cases went up faster by the end of September than we would have anticipated, and the part of the reason was that we had large numbers of people returning from other countries bringing the virus home with them, and we don't want to see that repeated this autumn. I would have to say that I did think that the last week was pretty shambolic at the UK level. Trying to get a sensible answer to a sensible question about the extent to which people were going to have to self-isolate, which countries were affected, how the system was to run in future, was pretty hard to do, and it seemed to change on a daily basis. We would have had a simpler system, one that was easier for people to understand. One of the things that I think we have learnt, and certainly been advised from early on in the pandemic, is that you have to try to make what you are asking of people as simple and as easy to understand as it can be, because the more easily it can be understood, the more likely it will be that people will be able to follow it. And I don't honestly think you could say that the traffic light system measures up to those sort of criteria.
Thank you. And the easing of lockdown measures and the lifting of all restrictions on meeting others for the first time in 18 months will no doubt be welcomed by many and could have significant positive effects on people's mental health. However, as lockdown measures have been lifted, research in the UK and elsewhere has shown considerable post-lockdown loneliness and people experiencing challenges such as fear of missing out. The adaptation to more post-lockdown Wales will be easier for some people than others. Are you concerned about post-lockdown loneliness, and what would be your advice for anyone experiencing such feelings?
Well, people who are experiencing those feelings in a significant and sustained way, then I think my advice would be to look for the help that is already available. And their help is available both through the health service, through GPs, both through local authorities, but also through the investments that the Welsh Government has made in making sure that there are helplines available 24 hours a day online, forms of help that people can use to overcome those sort of feelings, strengthen third sector services as well. So if you are feeling lonely, isolated in a sustained way, then you should look for help. One of the reasons why we have been so keen today to go on asking people to do the sensible things, the small things that keep us all safe, is that we want people who are anxious and who may have some underlying health conditions not to be scared off from going out and about, visiting shops, going to other places, because they think that level 0 might mean that people would have forgotten the need to act carefully because there are other people in the community whose health may not be as good as yours. So we are very keen that as we take advantage of our ability to move to level 0, that we go on acting in ways that allows people who have felt cut off, we don't force them back into feeling that it's even more risky now for them to go out and meet other people again. It doesn't have to be that way. Most people in Wales show us day in, day out that they want to make that contribution and to take care of others, and you can do it in a way that will help the sort of people whose experience has been difficult in the way, Nathan, that you've just described. Thank you very much. Finally, today to Andrew Nuttall at the Leader.
Thank you, Minister. With rules changing in Wales this weekend, and there's been a large push in recent weeks and months for people to staycation, there's been a big influx we've seen here in North Wales, people coming to enjoy our coastal towns and places like that. How will you make sure that people in England, Scotland, anyone who's visiting Wales will know that the rules are different, especially in England, where rules have been sort of scrapped a bit more than it has done in Wales?
Yeah, thank you, Andrew. Well, I am very glad for those people who work so hard in our tourism and hospitality industry and who've had such a torrid time during some parts of coronavirus, that they are in a better part of the cycle now, and that's been very noticeable in North Wales. I was there myself last week and could see people out and having enjoying themselves, but enjoying themselves in that responsible way as well. And I've said before, we must take some heart from our experience last year when visitors were able to return to Wales, and the experience was that those people turned out to be just as keen to make sure that they kept themselves and other people safe as anybody else would be. I do think people are more used to it, Andrew, than they were in the beginning. People understand now that if you come to Wales, Welsh rules apply. We'll be using the sort of things we've used in the past, the signs on top of motorways, announcements when people come on the railway and so on, so that visitors will be aware that if you're coming to Wales, the rules in Wales will be different, and that we will work hard to make sure they know those differences and can then observe them properly.
Thank you. And you've already touched on this with another question. So you touched on the need for booster jabs later on in the year. Obviously, Wales has had such a successful vaccine rollout already. Our minister's already in discussions to sort of get plans in place for this, because it's going to be a big effort to get people re-jabbed, I suppose, and get them all set for the winter months.
Yeah, it will be another huge effort from those people in the health service who we've relied on so much already. The good news is that plans are in from every health board in Wales ready to go with the booster campaign. We're waiting for the final advice from the JCVI, the Joint Committee on Vaccination and Immunisation. If that advice comes to us early in the month, we are ready to start the booster campaign in Wales in August. We would focus our efforts on the most vulnerable people in August. If we don't get JCV advice until the end of the month, then the campaign will start in September. But as soon as we got the advice, everything is now in place in Wales to be able to get going on it. And from our point of view, the sooner we're able to start, the better and more effective we think the booster campaign will be. Thank you all very much indeed. Diolch yn fawr. That's it for today.